Well, some might say as technology advances, so does our healthcare. For example, less invasive procedures and faster healing time. I want you to meet Dr. John Wanebo. He's a neurosurgeon at Barrow Brain and Spine Institute, and he's here today to show us how brain and spine surgery techniques have evolved, and by those evolving, what does that mean to your patients?
Well, the techniques and technology have allowed the surgery to be safer and more effective and less invasive.
Yes, which means faster recovery time, less complications.
True.
Okay.
Right.
Now, I want to make sure I get the terminology wrong, because I'm learning a lot here from you this morning. It's non-invasive, or you call it what?
Less invasive.
Less
or
invasive.
Minimally invasive.
Minimally invasive.
It's always invasive.
It is true. It's true. You can't do non-invasive brain surgery. There is no
less
such thing.
invasive. Yeah.
All right. Let's talk about some of these tools that you brought along today. And this is old school. Can I say that? Old school? Old technology?
Yes. Yes.
Versus new technology.
That's correct.
Now, what does this mean to the viewer at home?
Well, in the past, we have used retractors to hold the brain over. This is a ribbon retractor, and this is a model of the brain. And so we used to put this retractor on the surface of the brain and attach it to an arm and hold it in a fixed position for a long time. And that applies pressure to the brain, which can damage it. And so we've evolved to the point of using older technology, but in a better way, where instead of using a fixed retractor such as this, we'll use a suction and gently hold the brain over intermittently just when we need it, and then when we don't need it, we take the suction away. And it's called retractorless brain surgery. So it's applying an old technique in a new way to make it safer for patients.
Yeah, absolutely. Let's take a look at what you have here is a, basically it's an image here. And what are we seeing here, Dr. Wanebo?
This is an example of what's called neuronavigation, where you can use an MRI of a patient. For example, this patient has a brain tumor, that white spot in the middle of the brain.
Oh, wow.
And we can use that in surgery, and where we focus our microscope, we can see exactly where the lesion is on the MRI. And so it allows us to go exactly where we need to with a better trajectory.
So, and this is the microscope, and this is what you're looking through in order to do the surgery?
Right, that's right. That's a view through the microscope showing a tumor in the very depth of the field. There is a suction retracting on the right, and that is the image where the microscope is focusing on the prior image on the MRI.
And so that's the tumor that we're looking at right
there?
there?
Yeah, the tumor
That's
is
amazing.
at the bottom and middle of the field.
That's amazing.
Right next to the brain.
Now, what is this MRI telling you as a doctor in surgery, and why is this important?
This is an adaptation of neuronavigation called functional imaging, where a patient has had an MRI prior to surgery, and you map out critical areas of the brain, such as speech, or where the motor fibers are. And so this example, the motor fibers are colored green or orange on the right, adjacent to a tumor, and this shows you your no-fly zone.
Your no-fly zone. Okay,
yeah.
So we're taking a look at the brain here again. And what do you mean by no-fly zone?
Well, you want to avoid critical areas when you're operating on the brain. And so this model demonstrates a key area. This red area is called the motor strip. That's where the strength area is for the opposite side of the body. And so, for example, if you have a tumor near there, you want to stay away from the critical area. And we can see that critical motor strip on the functional MRI and avoid it at the time of surgery.
Because as you pointed out to me, the brain isn't really painted red to tell you what to avoid.
Not usually.
Okay.
We're still waiting.
All right. All right. Let me take a look at these here real quick and tell me what is the technology behind these, if you don't mind, very quickly. This is old and this is new. What's obviously we can see the difference.
This is an old plate that we use to join the vertebra and the cervical spine to do cervical spine fusions when there's a herniated disc. And the plate sits in front of the vertebra, C6 and C7, and it can push on the esophagus and disrupt the tissues near it. We've evolved the smaller plates which sit in the disc space, do not sit on top of the vertebra, and prevent distraction of the esophagus and a little less dissection to put them in. So they're an advantage to these procedures that we do.
Yeah, so that's again a faster recovery, less complications.
In general, yes. That's
all right. Well, very good information, and it's all about the advancement in technology, which is Barrow and Spine, which is what they specialize in. 480-425-8004 for more information. They also have a website, barrowbrainandspine.com. Of course, they are located at 7301 East 2nd Street, Suite 106. That is in Scottsdale.